Ensuring appropriate antibiotic use is crucial in preventing the development of antibiotic resistance and providing optimal patient care. Here are some common pitfalls associated with antibiotic prescription. Pitfall number 1: inadequate source identification. It is essential to accurately diagnose the infection source before prescribing antibiotics. Examine the patient carefully to seek occult sources of infection. Relying solely on antibiotics to treat infections without addressing underlying causes can delay necessary surgical or other interventions. For example, occult sources of infection may include bacteremia, infective endocarditis, deep tissue infections, and infected medical devices. Deep tissue infections may include anal abscess, liver abscess, Fournier's gangrene, or osteomyelitis. Infected medical devices may include indwelling catheters, prosthetic valves, or vascular grafts.
Pitfall number 2: overreliance on broad-spectrum antibiotics. Excessive use of antibiotics can lead to disruptions in the patient's microbiome and development of antibiotic-resistant bacteria. This can render antibiotics less effective, making it difficult to treat bacterial infections in the future. For example, using carbapenems as first-line therapy for suspected urinary tract infections instead of narrow-spectrum options can lead to the emergence of multi-drug-resistant bacteria.
Pitfall number 3: inappropriate dosing. Incorrect dosages can result in treatment failure or adverse effects. For example, administering vancomycin without appropriate dose adjustments can lead to suboptimal levels and ineffective treatment of MRSA infections. Vancomycin dose should be adjusted based on a patient's body weight, renal function, and regular trough levels monitoring.
Pitfall number 4: not considering local resistance patterns. Tailoring antibiotics to your hospital's susceptibility data is crucial. Tracking emerging patterns of antibiotic resistance allows providers to precisely tailor antibiotic therapy and prevent the spread of existing resistance. Antibiotic stewardship programs should provide regular updates to prescribers, pharmacists, nurses, and leadership on process and outcome measures that address both national and local issues, including antibiotic resistance. For example, prescribing ciprofloxacin for community-acquired urinary tract infections, unaware that local E. coli strains are highly resistant to this antibiotic.
Pitfall number 5: ignoring allergies and side effects. Failing to review a patient's history can lead to adverse reactions, allergic reactions, and treatment interruptions. Adverse reactions include gastrointestinal disturbances, skin reactions, and even organ damage, such as renal toxicity. Allergic reactions may range from mild rashes to severe anaphylaxis, which can be life-threatening. For example, administering a penicillin to a patient with a documented penicillin allergy, resulting in an allergic reaction and treatment interruption.
Pitfall number 6: not de-escalating therapy. Failing to adjust antibiotics based on clinical improvement can lead to unnecessary prolonged treatment. Broad-spectrum antibiotics can disrupt the natural balance of the body's microbiota, leading to the growth of opportunistic pathogens or superinfections, such as Clostridium difficile infections. For example, continuing broad-spectrum antibiotics for a patient with uncomplicated cellulitis, even after clinical improvement, instead of transitioning to a narrower-spectrum agent.
Pitfall number 7: inadequate duration of treatment. Prematurely discontinuing antibiotics can lead to relapses and recurrent infections. Failing to educate patients about the importance of completing their antibiotic regimen as prescribed or about possible side effects can lead to noncompliance and premature discontinuation of the drug. For example, stopping antibiotics for a patient with complicated intra-abdominal infection before completing the recommended course, leading to relapse and the need for more aggressive therapy.
Pitfall number 8, unnecessary treatment. Antibiotics are only effective against bacterial infections, not viral infections like the common cold or flu. Prescribing antibiotics for viral illnesses is not only ineffective but also contributes to antibiotic resistance. Different cultures and socioeconomic backgrounds can influence patient expectations and attitudes toward antibiotics. These factors may contribute to overuse or misuse of antibiotics. For example, succumbing to patient or parental pressure for antibiotics, even when not medically necessary, can lead to inappropriate antibiotic use.
Pitfall number 9, failure to reassess. Regular evaluation of a patient's response to antibiotic treatment involves ongoing clinical assessment, laboratory tests, imaging studies, patient feedback, and consideration of adverse reactions. For example, neglecting post-antibiotic therapy monitoring may lead to unnecessary complications and treatment failure.
Pitfall number 10, inadequate infection source control. Treating the source of infection, source control, is just as important as prescribing antibiotics. Relying solely on antibiotics to treat infections without addressing underlying causes or complications can delay necessary surgical or other interventions. For example, administering antibiotics to a patient with an abscess without draining the pus, leading to persistent infection despite antibiotic therapy.
Take-home message. In conclusion, to mitigate these pitfalls, healthcare professionals should adhere to evidence-based guidelines for antibiotic prescription, prioritize accurate diagnostics, educate patients about proper antibiotic use, and promote infection prevention strategies. Additionally, promoting antibiotic stewardship programs and a multidisciplinary approach to patient care can help address these challenges effectively. Remember, thoughtful and judicious antibiotic use is a shared responsibility that benefits both individual patients and our global healthcare community.
Thank you for watching. Please subscribe to our channel by clicking the subscription button. If you have any questions, feel free to leave a comment below in the comments section.